Hi, welcome to Facebook Live. I'm Dr. Annette Mercatante from the St. Clair County Health Department. We also have with us...
I'm Justin Westmiller. I'm the St. Clair County Homeland Security and Emergency Manager.
Hi, Justin. We're doing this remotely from two different places, so bear with us. Thanks for joining us. We're here today to answer your questions and as well as go through some important topics and areas that we know you're all interested in. So as usual, I'm going to start out with some of the brief data points that we want to go through. Again, feel free to go to our website where we update our dashboard every day with the most current numbers. Right now, we continue to have about an average of 4 new cases a day, which is a stable rate of new COVID diagnoses. We've been stable now for at least 2 weeks, and our percent positivity rate for testing has likewise remained under 2%. Our demographics has stayed pretty stable, although nationwide, as you know, we're seeing a shift for younger patients, and more recently we have also seen shifts towards younger patients, but our total demographics remain pretty much unchanged. Next, we're going to talk about our graph. You'll see the flow of new cases as we go over time, the large peak at the beginning, a second peak pretty much driven by some of our congregate setting nursing home situations, and now what we're in this gradual increase with a somewhat of a plateau, and you can see there's been a little variation, and that's where we are now. And what I want to emphasize, as I did last week, is this is a great place to be. Well, the greatest place to be would still be at the bottom going down. But given where the rest of the country is and where parts of our state are, being in this kind of low 4 cases per day in a relatively stable place, I consider this a golden opportunity. What we need to do is keep it here. If we keep it here, we can do our job effectively with the staff we have. Our hospitals are doing just fine, and we're really not seeing a great deal of impact on our community. But it's really hard to keep that lid on, which we're going to talk to about as the show goes on. And then the rest of our data is, again, our testing capacity, which is stable, if not even a little better. So we're doing a good job keeping people tested. And as you can see, the amount of percent positives there is low and stable. And then finally, don't forget to go to our dashboard, which is scchealth.co, and you can find all the updated numbers, demographics, etc. And like always, send your questions to COVID-19@stclaircounty.org, and we'll try to answer your questions accordingly.
Tell them they can type their questions out.
And you can type your questions into the Facebook, and we'll see them live as we go. So while we're waiting for our first live question, let's get to the masks. That's the big hot topic. Everybody wants to talk about masks. And as the medical provider here, I'm going to speak to the specific medical conditions that would constitute not being able to wear a mask. There really isn't good science on this, but there are some things that are self-evident. If you have a bad rash on your face, if you have facial deformities, if you have a severe difficulty breathing and shortness of breath, it's going to be difficult to put a mask on. It's difficult for people to wear masks with a lot of anxiety or PTSD symptoms, and those kinds of things may make it very difficult for you to wear a mask. But let's make a point here. If you have asthma or COPD or an underlying chronic lung condition, you're actually one of those people who's at greater risk for severe complications of COVID. And it actually may be of more benefit to wear a mask in those conditions than to not. So please weigh the mask issue carefully. None of us are used to wearing masks. They're uncomfortable and they're hot. But just like a situation where we're trying to put on a new pair of shoes or maybe a clothing item that we're not used to wearing, it takes some adjustment and getting used to. Try different styles. Gradually increase the time that you're wearing it. Feel free if you're getting kind of uncomfortable, walk away from the people you're around and pull the mask down and catch your breath. But as time goes by, I'm really hopeful and quite certain that people are going to become much more accustomed to this, and it won't be nearly the burden that we think it's going to be. So keep up the good work. If you're still not sure about whether you can or cannot medically wear a mask, do consult your medical provider. Any other questions? Want to go ahead?
One that just came in is, do you feel it's safe for school, summer sports, and practices to continue? Biggest question is football.
So football's not, they're doing conditioning. I do know that. Football is not doing the person to person. So anytime you get two people together close, exercising, there is clearly a greater risk there. I say this every week, and I'll say it again, we're not going to talk safe. There is no way of moving through our lives, going through our day-to-day business, and having a life outside of your home in a bubble that's safe from COVID. There's viruses everywhere, it's highly transmittable, but there's risk and riskier. So we weigh those risks and we weigh those benefits. The Michigan High School Athletic Association has released really good guidelines that I believe all of our school districts are following that minimize that risk. And I believe as long as they're following those guidelines and we continue to be observant and aware of what's going on, it is in our kids' best interest to try and continue to participate in normal life. If we identify positive COVID cases in a situation where there is something like that going on, we'll have to stop it. And that's just the way we're going to have to proceed.
And let me jump in on that a little
Sure.
bit. We know that it's difficult on all of our school-age children right now. And you and I are both working very hard with all the superintendents to figure out and work through all the processes. And again, we have another meeting later on this week. So, for our public out there, our community, we give you our word that we're working as hard as we can to get the right answer for the safety of the staff and students of all the schools in our community. We just want to make sure that you all know that.
And once again, not to be a broken record, but the answers might change. The process might change as the situation changes slowly. And it's not business as usual. There are going to be changes in the way your kids participate in activities like that. But it is a way of trying to balance from them not doing it at all.
So speaking of masks,
Someone asked if they are playing sports outside, such as baseball, should they be wearing masks? What about band camp?
So during the times where you're getting instructions, where you're maybe learning new methods, a mask is always a good idea. Anytime you're near another individual. When you're actually exercising and certainly playing an instrument, it's going to be very difficult to insist on mask wearing. And that's where physical distancing is going to be really important. So it's going to be a combination of both. But wearing a mask is always a good idea when possible. And that's just the way you're going to have to put it on, take it off, put it on, take it off. But it's a good idea to try and use it as much as possible.
Good question for Justin.
Justin?
On the same mask topic. Who is enforcing the mask up order in our community? And has anyone gotten a fine yet?
So, to my knowledge, since the governor put out her executive order that started being enforced on Monday, we don't have any major enforcement action that has happened in the county as of yet. But all of our law enforcement partners have agreed to uphold all the laws of the state of Michigan, all the laws of the county of St. Clair, and all of our local laws. And so that's what we're working with right now. We continue our law enforcement partners continue to use their discretion, and we expect that should the health department need assistance in any businesses or any major situations, we certainly expect that it will be supported and the mask ordinance will be supported in those situations. So we appreciate that fully.
So just to embellish on that, as a health department, our goal is health. Even though we do have some regulatory authority and under the public health code, we have a fair amount of authority to protect public's health. We're not going to worry about somebody walking down the street without a mask. On the other hand, if we have a situation where we have people that are positive, where we have multiple complaints, where we have an environment that we deem to be particularly hazardous, we will intervene in those situations using whatever resources that we have.
And also, if there are any businesses in St. Clair County that are having any issues and they would like to report to my OSHA, there is a hotline, and it's 855-SAFE-C19. We encourage all of our businesses to report any individuals or anybody that they deem it necessary to that number.
Agreed. Okay.
Okay, one more about mask, and then we have a new question.
Okay.
Is there any harm in wearing homemade masks for long periods of time?
So the question is there any harm in wearing a homemade mask? And I'll just say any mask for a long period of time. And the simple answer to that is no. We have surgeons that wear masks, really heavy duty masks, for hours and hours and hours, 10 hours or more. Studies have shown consistently that wearing a mask does not increase CO2 levels, nor does it reduce your O2 saturation levels. The physical discomfort of wearing a mask is really what people have to overcome. But generally, there is no long-standing harm that's going to come to you. If you're feeling dizzy and uncomfortable, walk away, pull your mask down, catch your breath. You're going to be okay. I'm not concerned with masks causing any serious long-term harm. I am concerned of COVID causing some long-term harm, and we are seeing more and more studies that are suggesting that even people that have really mild or no symptoms with COVID have consistent long-term injury patterns in their lung tissue, neurological tissue, etc. So this virus needs to be taken seriously, and again, it's the risk-benefit issue of where you can actually get into more trouble. Certainly, it's not with the mask. Next question.
Why is our ratio of death versus recovery due to COVID-19 seemingly so much higher here? That is, our numbers show about 8 to 9% death rate for infections. Is that not much higher than other areas? Is it the strain that is here that accounts for this, or other factors?
So our death rates and ratio, I'm not sure what you were using as a calculation. The question is, are our death rates higher here than in other communities? And the answer is no. We've looked at that several ways. Do understand there's a couple things. Number one, St. Clair County does not have a lot of numbers. We're a small community and things get skewed pretty easily. At the beginning, most of the cases that were counted were people that were going into the hospital and subsequently were much more severely ill. So over time, these variations are going to be balanced a little bit better, but it's going to take a while. It's going to take a year or two of more data to really get an idea. And I absolutely don't believe we have a more dangerous strain in our community. There are some genomic differences, but for the most part, the state and the CDC have reassured us that these variations in genomes and DNA aren't indicative of a more serious virus. That they might be a little bit more transmissible over time, but we're not seeing a more deadly strain in our community.
Another mask question.
Another mask question.
Are cloth masks better and or as good as paper medical masks?
I don't think there's any real research on that. There's very little research on cloth masks to begin with, and certainly the paper masks are limited as well. But we do know when you do studies on just respiratory expression of respiratory droplets, that putting any kind of barrier in front of your nose and mouth reduces the amount of respiratory droplets that get expressed. Your hand will do that too. And if you remember during flu season, we always talk, cover your cough. We talk about just doing this. So what the actual numerical benefit of that is, again, remains to be seen, but we're quite certain that there's a benefit. And of course, the reason we recommend cloth masks is they're much more readily available. Not only that, but you can wash them and reuse them, and they're a lot more economical for somebody. You can even take a t-shirt and create it into a mask, where buying the paper masks are just kind of it's an extra expense for some people. So I would feel comfortable people using one or the other. I substitute them back and forth, whatever I have in my purse. But feel comfortable using these masks. If you really need extra protection, you're going to be moving up into that N95 category, and that's really we want to reserve that for our healthcare providers who are being exposed to aerosolized respiratory work.
Nancy, do you want to ask the next question?
Let's go on to contact tracing and exposure sites.
Mm-hmm.
Can we expect to know when businesses have positive COVID-19 cases, such as the river crab? Is it mandatory for businesses to notify the health department?
So the question is, can you expect to know every time there's a case in a business? And if you're just Joe Public, the answer is no, okay? It is mandatory for a business to notify the people, employers, clients, vendors who may have been exposed to that positive person that they're aware of. So if you have had a potential exposure, you will hear from both the employer and probably for us, because it is also mandatory for a positive case to be identified by us. We will often hear from employers and sometimes the positive case themselves, and if we don't, and we encourage them to call us early, we don't, it shows up in our system and we track it down that way. So positive cases will become known. Those cases are investigated by the medically trained expert staff that we have here, and we determine whether the level of exposure, who should be contacted and who shouldn't. If that exposure risk, let's talk about the river crab, if that exposure risk is one where we can't be sure of the people that were there, like we can't call those people because we don't know who they are, that's when a public notice will go out to warn the people who have potentially been exposed, to give them a heads up. If we feel that exposure risk is not really there, you probably will not see a press release coming from us. And that's just the way we're going to roll. We can't announce every single one. Let's face it, we're working up anywhere from 4 to 7 or 8 cases every day. We can't notify everybody all the time, but we will notify the public when we feel there is a need for you to know that for your own health and safety. And by the way, just because a case is in a business does not mean the business is not safe to go to. Let me make that very clear. These businesses, by and large, are doing all the right things. COVID is just everywhere, and sooner or later we're going to find cases everywhere. So a case in a business does not mean the business is unsafe. It just means that people happen to be in the wrong place, maybe at the right place in the wrong time. So please don't reserve your going to those places because you hear that there's a case there. Those businesses have properly disinfected, they have done all the right things, and they're ready to go, and just as safe a business as anywhere else at this point.
Okay, next question that came on the Facebook Live. If the health department calls, will it be from a local number? Will you leave a message? I know I'm not the only person that doesn't answer unknown numbers.
That's a good question, and it would be a 987 number, although it could be one of the nursing numbers that's called, and we would definitely leave a message, and you would call us back, and a health department person would answer that phone. So if you're not sure who's calling, just call us back. Just call us back. I think that's the easiest way. We will leave a message. We will leave the phone number for you to contact us. And if you do that and you have somebody pick up the phone that doesn't know what you're talking about, you know it's probably not right. You can also just call us if you have some concerns, and we'll hook you up with our communicable disease nurses and staff, and they can look you up and find out if we did in fact call and leave a message. I'm not sure the exact number that's going to show up on your dial, though. It'll be an 810 number, though. I can be sure of that. Okay.
Okay, next one on Facebook. A lot of people are going out of county for testing. Are those testing positive out of county included in our numbers?
If they live here, they are. Doesn't matter where you get tested. If you live in St. Clair County and you have a positive test, it will end up here. It may take a little longer. It might get lost in the way and end up in a different county's database. But as I said, each case is individually investigated and allocated to the proper place. Sometimes our cases show up here and we find out they belong in a different county and we move them. So that's why case numbers change a little bit. But yeah, if you live here, it doesn't matter where you get tested, the case will count here. And by the way, if you get tested multiple times, it doesn't get counted as multiple cases. Again, it may show up multiple times, but nurses, our staff review these cases, they merge them, and multiple testing still results in one case that's counted. I can guarantee you that happens every single time eventually. And when I say eventually, we're talking a matter of days, not weeks.
Right. This person says, well, if they are touching things with COVID and you touch it after, how is that safe?
So we do know that COVID germs can last for several hours, we're assuming, maybe even up to several days depending on the surface. What we don't know is what that level of contagiousness really means. If you touch something and there's COVID on it, and you touch your face, there is that potential chance. Now, there has never been a true documentation of a disease process that's occurred solely from what's called fomite, from touching one thing to your face. It's uncertain, but theoretically possible, which is why if you touch something, you want to wash your hands, particularly before you touch your face. And so I'm assuming that this discussion is based on the sports thing. I'm assuming she's referencing maybe the sporting thing or the kids using a ball or something. But the idea is they would they pass the ball. You're not going to wash the ball, in between. But you're going to, number one, a lot of the conditioning is not using a ball. I can tell you that from the recommendations. They're discouraging single-use things like that. But then, again, you're going to wash your hands before and after. You're going to wash the ball before and after.
So I can talk a little bit. About
Yeah.
that too. So, like right now, we're at a travel softball tournament, and each team is getting their own set of softballs. None of the players can share equipment or share water bottles or share anything at all. Actually, only 3 girls can sit in the dugout at a time. The rest of the girls have to sit 6 feet apart. It's totally abnormal. It's very difficult on the girls, but they're doing it because they want to play. They want to be safe, and they've had a very safe season. Our team has played 4 tournaments, and we haven't had a single girl sick. No one on the team's been sick. It's been very successful so far, and all the tournaments have done a really good job keeping people away from each other. Everybody that's non-familiar has to sit 6 feet apart, and everybody's done a really good job of that. So, and those are the ways that you do that, so that you can continue to play and do what you need to do to keep these tournaments rolling. So, anyway, just a quick side story.
And I go back to the fact that we don't assume that any of these changes are going to eliminate the risk of getting this virus. You just weigh that against how can you reduce the risk, and if you really want to do these activities, you've got to weigh that. Now, if you don't want to get into that risk, then you have to make a decision not to do it, and that's valid. But those are tough, and we're talking about a long haul here, people. We're not talking about a couple more months. We're talking about probably a year of this, depending on what happens. So it's not going to be like over in September or October. So we're going to get used to this idea of risk-benefit assessment.
This one's for Justin. Can you give us an update on the schools and your work groups and what's kind of coming out? Anything yet regarding fall school time?
So while we're waiting for another question to come in, obviously we've been working all week on the new mask mandate, and I'll tell you that I have seen some really good results in the community. I know it's been a difficult subject, but slowly and surely, I've seen quite a few more people wearing their masks and getting more comfortable. And I want to thank the community for that. It's a difficult thing. This whole COVID thing has been very difficult. It's hard on people. We know it is. But I want to thank you all for wearing your mask and doing what we need to do to start moving the needle on COVID-19 and stopping some of this community transmission. We're seeing that in the results that the health department puts out and puts on their dashboard. And so, that's due large part in all of our community members. So thank you.
We have a few more questions. Does a positive antibody test indicate you previously had COVID-19?
Do we have any other questions?
Yeah,
Jen?
the question is, positive antibody tests mean you've had a previous COVID-19 infection? And the answer is maybe. So antibody tests remain very problematic. A community that has very low transmission, less than 10%, we're still looking at a very high rate of false negative and false positive results. It depends a lot on which type of test you have, who made it, the manufacturer, etc. So the question is maybe. Theoretically, antibodies are produced in our bodies when we have an exposure to a germ, and if the test detects that. But these tests are not highly reliable. So I would suggest if you have a positive antibody test, particularly if it's an IgM, an acute phase, to go on and get a more reliable PCR test, a nasal swab. That gives us a lot more information that we can do something about. Just a positive antibody test, it's not clear. And don't forget that it's not clear whether an antibody is protective or not. So that's probably the most important information. I cannot say to you that if you've had a positive antibody test, an IgG in particular, that you don't have to worry about getting infected. And of course, that's what we want to know, right? We want to know, do I have to worry anymore since believing that that person was not infectious. Now, what about the people that were exposed to that person? If they didn't get tested, we will not in fact know whether they have been infected or not. And if they have been exposed and incubating it and are expressing the virus without having any symptoms, again, if they're not tested, we will not know. So my suggestion to all of you, and it doesn't even matter if you know they've been positive or not, assume that wherever you go, if you're going to be close to a bunch of people, that there's a possibility that they are infectious and there's some release of virus, and that wearing a mask and them wearing a mask is going to provide you the best protection we have, short of you not going, okay? So if you have a significant cardiovascular disorder or something else where you know that you're a high risk, going to these types of things have to be weighed very carefully. That risk of getting an infection, because even masks are not 100%, they're not even close to 100%, right? You have to weigh that risk against the benefit of being and expressing your condolences and being with people you love during this difficult time. I don't have a real answer, but you have to consider this on a personal level, what your personal risk is, and then what the risk is of the family. Most people are very responsible when they know they have the infection. They're supposed to be in isolation, and they shouldn't be at a memorial service. That's most people. So you just have to be careful. And ask questions maybe. Ask them really what their status is or how they feel, because they may feel very confident that they're okay, and that may make you feel better as well.
Okay, we're coming up to the end of the show.
No!
But we already have one more question. I think
Sure.
Nancy has one that we lost sound for temporarily.
Okay.
And Justin's gone. So anyways, this one asks, how long after someone tests positive should they be retested to make sure they're clear?
Okay, the retesting strategy that has shown up in the CDC guidance is not very clear when you should be retested. We do know that after 10 days of an infection, very, very few people continue to shed virus. Sometimes the tests can remain positive, though, for a very long time. That does not mean they're infectious. So the repeat testing strategy, quite honestly, I'm not really keen on. There are situations where it's recommended with healthcare providers, with people that may be at high risk, to be absolutely certain. But for most people, if you have waited the 10 days since the onset of your symptoms or from your positive test, and you're at least 3 days without a fever, and you are in fact feeling better, I feel quite comfortable that you will not be shedding virus and infecting a lot of other people when you go back out. And in my mind, that's good enough. If somebody's requiring a test, a negative test, I would wait at least that long. I would wait at least those 10 days to get another test, and then of course if it's positive, you're gonna have to get another test. So you know, sometimes repeat testing can be a slippery slope, and it can put you back in isolation for very long periods of time, which may actually not be clinically adequate or correct. So.
Okay, Doc, this will be the last question.
Okay.
Nancy, I think we lost Justin, so maybe, Doc, you can answer.
Okay.
About the schools, this person is
okay.
asking that we still haven't answered. So can you repeat the one about the
Sure.
schools?
So there's a local work group.
There's a local school work group and a reopening work group. Mm-hmm.
And so kind of talking about where everybody's at right now. Is there any movement and any answers about school moving
Yes.
forward?
So the school work group has been very, very busy, as been each one of your school districts has been very, very busy. And everybody is trying to work through the My Safe Start school guidelines that the governor released, as well as other very helpful documents that help us understand what absolutely is required in the schools versus what's highly recommended versus what would just be really helpful to have. And of course, that's going to vary a little bit from school to school, what they're capable of. So each school district is going to have a plan that they're going to be based on whether or not we're a phase 1 through 3, which means we're not going back in person. If we're a phase 4 still, which we are now, we'll be getting our kids back to school if with certain restrictions. And then phase 5, which is down the line, it lines up in more. So your school districts are all going to be individually endorsing plans that your Board of Education is going to be reviewing and endorsing. I believe that's going to be happening very soon, probably in the next month. And then all parents and guardians should be receiving some letters that we're trying to help draft that will kind of explain a little bit what this is going to look like. And so you should have some answers very soon. But I can tell you what, at the very least, it's going to look like. If we go back to schools in a phase 4, your students are going to be wearing masks in various degrees, under various circumstances, but they're going to be wearing a mask on a bus. They're going to be wearing masks going in and out of the classrooms. We're going to be limiting how much kids are interacting with each other. And it's for very important reasons. Number one, we know it helps reduce the spread of the infection. But number two, if we identify a positive case, we know that those kids are only interacting with a smaller group, we will be able then to do a better job of figuring out who's been exposed. So hopefully that's going to work out well enough where everyone can hopefully stay in school. And yes, things are coming along. It's not easy. Believe me, this is not easy stuff, but people are working very hard on it. And you'll be hearing very soon.
Okay, closing comments?
Closing comments. Justin, are you back on? Justin's not on. So my closing comment to all of you is really simply this. If you want your kids to go back to school, if you want your businesses to stay open, we need to follow the plan. We need to stay away from each other. You need to avoid large gatherings. I know that executive orders say 10 and 100, but the bottom line, the intention is avoid large gatherings. Inside particular, outside as well though. Even with the fresh air, there's risk. And please wear your masks because it does make a difference. If we all wore a mask, if we had 90% of compliance or greater, we could make a significant dent in this this graph, okay? And we are doing a good job. St. Clair County, I'm very proud to be part of this community because a lot of the communities around you are seeing steady increases in cases and percent positivity. And this county is holding its own. So keep up the good work. It is not because we're better, or we have better immunity, or we have a weaker virus. It's because we're doing the right thing. Probably also because we have not as dense of a population. We have a lot more room to move around in, but that's an advantage we want to play up. So keep up the good work, everybody. And we'll be here next week to answer more of your questions. Thanks a lot.